Hi doctors, welcome back to the channel. Let's talk about something we all deal with but wish we didn't have to: prior authorizations. They're necessary, sure. But the delays, the phone calls, the paperwork, it's a full-time job on its own. And honestly, it gets in the way of what we're really here for: patient care. Say hello to CoverMyMeds, a game changer when it comes to handling prior authorizations electronically. Now, if you haven't used it yet, here's the short version. CoverMyMeds is this smart, powerful EPA platform that lets you submit prior auth requests electronically to almost every health plan out there. It connects you with insurance companies and pharmacies in real time, right from your system. Think about that for a second. No more endless hold music. Just clean, fast submissions, and quicker patient access to medications. Imagine knowing exactly what a patient's insurance covers while they're still in your office. Private insurers? You name it, it's compatible. That's why over 50,000 pharmacies are already on board. Now let's talk strategy. Pair CoverMyMeds with a virtual medical assistant, a real person, working remotely, trained to handle the admin side of things. These virtual assistants take over the grunt work, filling out PA forms, verifying insurance, following up on pending approvals, so your staff can actually focus on people, not paperwork. And here's the outcome: your team breathes easier, your workflow runs smoother, and most importantly, your patients get their meds faster. A small practice in Dallas starts using CoverMyMeds plus a virtual assistant. Within weeks, their authorization backlog shrinks. Claim denials drop. Patients stop calling to ask, "Is my prescription ready yet?" They spend more time with patients and less time on hold. But maybe your team is already maxed out. That's where healthcare outsourcing comes into play. Think of it like extending your team without adding overhead. Healthcare BPOs have experts trained in PA workflows, tools like CoverMyMeds, RCM, claims, all of it. You save on costs, improve turnaround time, and get peace of mind that someone's handling the backend accurately. And if you're considering outsourcing, make sure you're partnering smart. Choose someone with 24/7 availability, RCM experience, and solid KPIs you can track. It's a big piece of the revenue cycle management puzzle. It helps speed up insurance verifications, smooth out claims processes, and protect your bottom line by reducing denials. So to wrap this up, CoverMyMeds plus virtual assistants plus smart outsourcing equals better outcomes, smoother operations, and a lot fewer headaches. If this video helped you or gave you a few ideas to lighten the administrative load in your practice, give it a like. Don't forget to share it with your colleagues, especially the ones who are still stuck in the prior auth paper trail. And if you want more tips like this, go ahead and subscribe to the channel. Take care, and as always, thank you for everything you do.